This topical liquid roll-on local anesthetic is used to relieve itching and pain from skin conditions like scrapes, minor burns, eczema, and insect bites. It can also help with discomfort and itching from hemorrhoids and other genital/anal issues like anal fissures and itching around the vagina/rectum. In addition, it can be used to reduce discomfort or pain during certain medical procedures/exams such as sigmoidoscopy and cystoscopy. The lidocaine in this medication works by causing temporary numbness and loss of feeling in the skin and mucous membranes. For best results, apply the liquid directly to the affected area and use as needed, following the recommended daily dosage. It is best to use this medication at the first sign of itching or pain for optimal relief. When using Dologesic pain relief, Lidocaine, 4% topical liquid roll-on local anesthetics, it's important to follow the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. Before applying to the skin, make sure to clean and dry the affected area as directed. Apply a thin layer of medication to the affected area of skin, usually 2 to 3 times a day or as directed. If you are using the spray, shake the canister well before using and hold it 3 to 5 inches from the affected area. If the affected area is on the face, spray the medication onto your hand and apply to the face. Do not spray near your eyes, nose, or mouth. If you are using the foam, shake the canister well before using and apply to the affected area. Do not use on large areas of the body, cover the area with waterproof bandages or plastic, or apply heat unless directed to do so by your doctor. These may increase the risk of serious side effects. After use, wash your hands immediately unless you are treating an area on the hands. Avoid getting the product in eyes, nose, or ears. If the medication gets in these areas, rinse with clean water. The dosage is based on your medical condition and response to treatment. Do not use more of this product, use it more often, or keep using it longer than directed. If there is an infection or sore in the area to be treated, consult your doctor before using the medication. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. After applying Dologesic pain relief, Lidocaine, 4% topical liquid roll-on local anesthetics, you may experience temporary redness, stinging, and a little bit of swelling at the application site. If these effects persist or worsen, it is important to inform your doctor immediately. If your doctor has prescribed this medication for you, it means that they have considered the benefits to outweigh the risk of side effects. Many people using this medication do not experience serious side effects. However, it is important to seek medical help immediately if you experience any very serious side effects, such as slow/shallow breathing, seizures, pale/bluish/gray skin, unusual tiredness, shortness of breath, or fast/slow/irregular heartbeat. Although very rare, a serious allergic reaction to this drug may occur. If you notice symptoms of a serious allergic reaction, such as a new/worsening rash, new or worsening itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help right away. It's important to note that this is not a complete list of possible side effects. If you experience any other effects that are not listed above, it's essential to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects or report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects or report side effects to Health Canada at 1-866-234-2345. Before using Dologesic pain relief, Lidocaine, 4% topical liquid roll-on local anesthetics, make sure to inform your doctor or pharmacist about any allergies you may have, especially to other amide-type anesthetics. It's also important to disclose your medical history, especially if you have broken skin or infection in the area where lidocaine will be used, heart disease, liver disease, or a certain blood disorder. If you are scheduled for an MRI test, it's crucial to let the testing personnel know that you are using this product, as some brands may contain metals that can cause serious burns during an MRI. Before undergoing any surgery, inform your doctor or dentist about all the products you use. It's important to note that children may be more sensitive to the side effects of this drug. During pregnancy, This medication should only be used when clearly needed, so it's essential to discuss the risks and benefits with your doctor. While this medication can pass into breast milk, it is unlikely to harm a nursing infant, but it's still important to consult your doctor before breastfeeding. When using Dologesic pain relief, Lidocaine, 4% topical liquid roll-on local anesthetics, it's important to be aware of potential drug interactions. Certain medications may affect how Dologesic works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without consulting your doctor first. Be sure to follow their guidance to ensure your safety and well-being. If this medicine is inhaled or swallowed, it can be harmful. If someone overdoses and experiences severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include drowsiness, irregular heartbeat, and seizures. Remember, it's important to take this medication as directed and to keep it out of reach of children. Make sure to attend all your scheduled medical checkups and appointments. This is important for monitoring your health and ensuring that the medication is working effectively for you. If you are using this product on a regular schedule and forget to use it as soon as you remember. If it is close to the time of your next scheduled dose, just wait and use the next dose at the regular time. Do not use a double dose to make up for the missed one. When using Dologesic pain relief, Lidocaine, 4% topical liquid roll-on local anesthetics, it is important to store it at room temperature and avoid freezing. Keep it away from children and pets. Make sure not to store the gel or foam or spray canisters near high heat or open flame, as they are under pressure. Do not puncture or burn the container. When it comes to disposal, do not flush the medication down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of the product. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.